Some of the strangest side effects that you get from botulinum toxin treatments are about injecting at the wrong depth. If you understand how the depth of your botulinum toxin injections affect the result, you can interpret and solve side effects way better. Let's start by looking at the master muscle so that you can relate what you just saw on that patient with how the injection depth may have caused that result. And the important thing with understanding depth is that it is a relative term. So it's relative to the total size of the structures involved. So with the master muscle, if I say deep injection, I probably mean having the needle tip in the lower third of the muscle. If that's a really big muscle, that's actually a different depth to if it's a really small muscle. And this is something that you need to figure out by examining your patient. Every procedure has to be based on the patient in front of you, not on some academic idea of what the right millimeter by millimeter depth is. So whenever you treat a patient with a master muscle that needs a little bit of shrinking, I always like to examine them first and get them to bite down and reveal the size and the thickness of their muscle as it's contracting. You can do this simply by doing this. I think it's quite easy to get an idea of how thick that muscle is and then aim for a place in that muscle that you're least likely to cause the side effects. Why do people generally inject deeper with the master muscle? It's because on the surface of the master muscle you have the risorius. The risorius literally originates from the surface of the muscle, and it plugs obviously into the modiolus here and is part of your smile. If you relax the risorius muscle, you get the awful side effect of not being able to smile properly. So we want to hide our botulinum toxin underneath the origin of the risorius muscle, but we also want to relax as much of the master as possible. If you are very deep and there's a lot of contracting muscle on top of the master, then you end up with the strange side effect of a bulge as the surface fibers contract in an odd way without the balance normally created by the deeper fibers, so you get this pinching bulge that causes a protrusion. My colleague just asked, does it mean that if you have a thinner muscle you actually have to be deeper? And this is actually correct. If you think about what we're actually trying to do in terms of safety, we're trying to avoid the surface of the muscle while also trying to relax the bulk of the muscle. So there's a compromise going on. But a thinner muscle, you have to be further away from the surface or as far away as possible, which means in relation to the periosteum, you are closer. It would be more appropriate to be nearer the bone in a very thin muscle than if you have a very big muscle where you may be further away. This is what I mean about the depth being relative. Let's talk about the DAO. This is one of the most popular lower face treatments. We treat the DAO in order to allow a lift of the oral commissure, make you look happier, even if you're not. So this muscle is involved in pulling on the modiolus and depressing the mouth. So if you relax it, you get the opposite. Now the downside is many clinicians hit the muscle next to it and also deep to it, which is the depressor labii. The depressor labii is an important muscle with smiling. When you smile, a true, genuine, broad smile, you actually pull your lower lip down and out. And if you want to understand what this muscle looks like in extreme situations, I often notice people's anatomy, and I always remember Cherie Blair having a really strong depressor labii muscle. And you can see what that muscle does. Then you can imagine what will happen if you relax that muscle, which is as you smile, your lip on one side typically does not pull down and you get an asymmetrical smile. Very upsetting because every time you get happy, people think there's something wrong with your face. Often people react as if you've had a stroke. It looks like something's wrong. And this makes you not want to smile. So this is why clinicians hate this side effect. And it happens because of a combination of the depth and the position of the injection point that we are using to relax the depressor angularis oris and how that sometimes affects the depressor labii. Depth is the first one we can talk about. As you're sliding the needle in to inject the depressor angularis oris, if you go deep enough, you are likely to get closer to the fibers that are actually pulling on the lip medially from the depressor labii. There's also another way that you can reduce the risk of hitting this muscle, which is to move more superior. I find it intuitively safer to not inject on the jawline. This is one of the common injection points clinicians use. You're trying to find the LO, which does this, find the origin of it and inject here. The problem with this, if you inject deeply, is that you're very close to the overlapping fibers with the depressor labii, and I think they can diffuse more easily here and affect the lip. If you were to slide up and feel the lateral border of the depressor angularis oris, which you can do if your patient contracts like this, you can actually feel where that muscle is. So I try and be superior and lateral, so I'm as far away from the lip depressors as possible, because the only other muscle here is a little bit of the buccinator muscle, and the risorius potentially, but although that's usually more superior. So we're trying to find this space in between where you're far enough away from all of those key muscles and you can relax the down pull without relaxing any of the other vectors in the face. So let's have a look at a couple of strange side effects that you can cause with injection depth error. And there's also another cause which I'll talk about towards the end. So let's have a look at this one, sometimes called the kidney bean chin. So this happens when you're treating the mentalis muscle. We obviously treat that to prevent the chin being pulled upwards sometimes, and it also removes some of the texture on the skin that you get when those muscle fibers are continuously contracted. You get little indentations. So you can inject the mentalis muscle, relax those, and usually get a good aesthetic result. What often happens, however, is that you don't treat the complete depth of the muscle. So this can happen because clinicians are trying to not inject too deeply, or they're trying to make sure that they're at the right depth. We're obviously concerned with hitting the depressor labii muscle here too, which is also a reason why many clinicians will stay more superficial. And what you can see in this video is the exact result of staying superficial. If you look closely at her chin, you can see that the top of her chin is not moving, and underneath you can see some strands of the mentalis muscle that are pulling up, causing this bunching on the surface of the skin, which looks like a kidney bean. So little bunching caused by muscle underneath pulling and running into the relaxed muscle on top. So this side effect is caused by injecting too superficially. But there's also another cause, or an easy pitfall that new injectors often make, which is if you see this on day 2 and 3, you start to panic and you think you've got a side effect. But if you wait until day 6 or 7, often it resolves. And really what's happening here is there's a period of time where some of the muscle fibers are reacting sooner to the botulinum toxin than the others, and so there's a natural imbalance. This is true with all the treatments that we have. There's a period where it's half-baked, and you need to hold your nerve and let your patient go through at least until a week, and actually, technically, it's 2 weeks, but I think usually you can tell by day 8, 9 what the end result is going to look like. If I was to fix this particular case, all I would do is look for where those muscle fibers are still contracting and directly treat them. And what I can see in this case is you can see the indentation on her chin where the muscle fibers are pulling in. I would go straight into those parallel with the muscle, aiming for its origin, which is near the mental crease, and I would inject 2 units either side, and that would probably solve it within about 3 to 5 days. In this next case, you see a problem caused by the exact opposite problem. This is also a mentalis treatment, but it resulted in a different side effect. The side effect here is that the depressor labii muscle has been affected. The depressor labii is normally pulling the lip outward and lateral, and that's now been relaxed while her chin is still actually contracting. So what has occurred is that the needle has probably gone underneath the muscle and maybe a little bit lateral to the muscle and affected the depressor labii muscle instead of the mentalis. This is what we're trying to avoid by injecting at the right depth. And these two cases really illustrate the difficulty and why precision is important, because there is so often a balancing act going on in the lower face between too deep and too superficial, and we need to really have a clear understanding of how these muscles work, where the origin of the muscle is, where the attachment is, and how to accurately stay within that muscle and not affect the nearby muscles. Which is why I prefer a technique that's a bit more like this. So I actually think the mentalis muscle is quite hard to understand in 3 dimensions until you think about it in a different way. Most textbooks give you this idea that it's a muscle that just runs around your chin. But it's better to think of it as a muscle that's almost projecting out of your chin and then is meeting on the skin surface. So its origin is near the mental crease and it's projecting outwards. And I'll exaggerate it with this piece of blue tack, which is not white tack. If I place it here where its origin is, what I'd like you to imagine is instead of it being flat against the muscle, that it actually projects out like this. So this is the reason why, as it gets more active, it pulls your chin inwards. But it also helps you decide a better way of injecting it. Because I think if you come at it like this, you will go straight underneath it quite a lot of the time and emerge out the other side. And this is where you might be closer to the depressor labii muscle. Similarly, if you're trying to be superficial, it's easier to relax just this part of it and have fibers underneath that are still contracting. So my preferred way to treat it, and especially if you have a side effect and you're trying to correct the side effect, is to think about it this way and then to come in a way that you think is parallel with those mentalis fibers. So I inject it like that. And if you're accurately in the bulk of the muscle, that gives you the most chance of treating the whole muscle without treating the nearby muscles. So here's a confusing question. Is this a deep or a superficial injection? The truth is, this is really about just accurately injecting the active muscle. So we are entering superficially, and it doesn't really matter if you go deeper or not, as long as you're using a normal insulin syringe, because you are in the channel of the muscle the whole way. So you're basically aiming to be in the middle depth layer, because I don't want to be underneath on the periosteum, which is a risk for depressor labii, and I don't want to be too superficial, because then I'm going to only relax the surface of the muscle and get the kidney bean problem. So I'm actually at an intermediate depth when you consider the plane from the surface of the chin, the anterior side down. But if you think about it in terms of injecting the muscle, I'm just trying to stay in the middle of the muscle. So I hope that helped you understand injection depth in the lower face. Don't forget not to blame your injections in the first 2 to 3 days, especially because those treatments are half-baked. Give them a chance to play out, and it may turn out better than you think. If you want to learn more about botulinum toxin in the upper face, I have a great download at the bottom with this video, and you can also watch this video here where I talk about the injection depths in the upper face.